In this video, we will discuss regarding opioid substitution therapy. De-addiction of patients dependent on opioids involves opioid substitution therapy, or OST for short. Now, let us assume that there is a patient who is addicted to an opioid, like, say, heroin. Now, when this opioid is suddenly withdrawn from a long-term opioid addict, this patient will suffer from severe withdrawal symptoms. To prevent this from happening, we substitute the abused opioid, in this case heroin, with another so-called less harmful opioid, and this will prevent withdrawal symptoms. In essence, this is what we call opioid substitution therapy. Now, opioid substitution therapy is a program designed for opioid-dependent IDUs, or injecting drug users. OST is a process in which opioid-dependent IDUs are provided with long-acting opioid agonists for a long period of time under medical supervision and along with psychosocial interventions. Methadone is the most common opioid used in OST globally, and buprenorphine is the second most common opioid used for OST worldwide. So this begs the question, can methadone and buprenorphine themselves cause addiction? And the answer is, of course. Then what is the rationale of using these drugs in OST? Well, the answer to this question is that OST addresses a number of issues faced by the IDU clients. The first one, and most obviously, if an IDU attempts to stop the abused drug, for example heroin, he or she will suffer from severe withdrawal symptoms and intense craving. OST will obviously reduce the withdrawal symptoms and intense craving. Abused opioids like heroin usually have a very fast onset of action and a short duration of action. Patients get desperate for the next high or hit, and they cannot carry out their occupational or familial responsibilities. On the other hand, methadone and buprenorphine have slow onset of action and longer duration of action. So this approach helps us to reintegrate the patient into society and helps the patient to carry out their occupational, familial, and other social responsibilities. Most importantly, the chances for uncontrolled spread of disease via contaminated needles, diseases such as HIV, HCV, etc., is extremely high with IDUs. And since methadone and buprenorphine are available orally or sublingually, there is no risk of spreading these kind of diseases. Another important issue is that IDUs procure their opioids through illegal means, and the purity of the opioid that they inject is never guaranteed. Often, very harmful adulterants are added into the opioid that they abuse. On the other hand, OST provides the drug in a manner in which the potency and purity of the drug is guaranteed, and this helps to avert overdose situations. Finally, IDUs often resort to illegal activities to finance their drug use. In India, OST is available in government-supported NACO centers. NACO obviously stands for National AIDS Control Organization. So it is available free of cost, and the client does not have to resort to illegal means. We need to know what are the effects of methadone at low, moderate, and high doses. At low doses, methadone helps to get rid of the withdrawal symptoms. that patients suffer from. At moderate doses, they help to get rid of the craving for opioids, and at high doses, it produces an effect known as cross tolerance or narcotic blockade. So, what does this mean? So, if there is a patient who is on methadone, then this patient would not get the opioid related high, even if he or she consumes street heroin. So, this cross tolerance or narcotic blockade makes methadone an ideal opioid agonist maintenance agent. So, in general, the maintenance therapy for opioid addiction consists of drugs that prevent withdrawal symptoms like methadone and buprenorphine, decrease craving, example again, methadone and buprenorphine, and prevent the rewarding effects of opioids, example, methadone, buprenorphine, and an opioid antagonist known as naltrexone.